This is Brian Wormers recording a lecture for medical surgical nursing on the assessment of the skin, hair, and nails. Here are your learning objectives, same as on the PowerPoints. This is a nice, quick, and easy review of the anatomy and physiology for you. This is also on your PowerPoints. So, functions of the skin. So it protects us from outside invaders, so bacteria and viruses and fungus and stuff like that. It creates a homeostasis for us, especially when we're talking about fluid and electrolyte imbalance. It regulates our temperature depending on whether we have goosebumps, whether we're sweating, basically those things. It's a sensory organ, so our tactile simulation, also whether we can feel vibration. It is vitamin synthesis, so we're talking about vitamin D and how sunshine gets converted. And then, of course, it's got strong psychosocial ties in our body image. So assessment of the skin can include demographic data, such as age, race, occupation, hobbies, things that might affect the skin. We can talk about social economic status, so how the environment affects that. Talking about poor hygiene or other things. We can talk about any drug use, whether it's prescription, over-the-counter, herbal, or none of the above. We can talk about allergies, and what their skin might do when they're having an allergic reaction. We can talk about nutritional status, including their food preferences, their hydration status. We can talk about any genetic and family risks that they might have. And then, of course, current health problems that might be co-committed with this. Some of the skin assessment that you can do is looking at the scalp, hair, nails, mucous membranes. So looking at the color and how the skin might be affected by temperature. If they're really cold, their skin might become a little bluish or a little even pale. We can look at their pigmentation. We can look at oxygenation. We can look at blood flow. If they have any lesions, I expect you to be able to do the ABCD. So looking for asymmetry, looking for border irregularities, looking for color variation, and looking at a diameter of greater than 6 millimeters. So if one of those things are present, they need to have follow-up. And then also know some of the terms for this. So in your book on page 423, we've got some of the classic terms for this. It's really hard to understand derm unless you use the words that are associated with it. You got to be able to inspect the skin, looking for any edema, any moisture excess, looking for any vascular changes. And so this can be, things such as birthmarks. The other thing that you can see is that if they're experiencing low oxygenation, they might have a bluish tinge to it. The other thing you might see is that they might have a lack of hair because those hair cells will die if they don't have good circulation. Palpation, so you can look at different lesions. Are they flat? Are they papular? Are they petechia, like in this case? Are they wet or are they dry? Are they oozing? Any turgor with this? Is it changing the skin elasticity? Any changes in skin temperature? So some things that are associated with aging, so thinning of the skin, delayed wound healing, hyperplasia, so you get too much skin, increased susceptibility to irritants, including sensitivity to sun, decreased inflammatory response, and then mottled hyperpigmentation. Hair assessment, so we can look for the cleanliness, distribution, quantity. We can look for any dandruff. We can look for any hirsutism, like in this picture right here. We can look at the nails. Are there any dystrophy of the nails? Are there any changes in the color plate? Do they have any petechial hemorrhages? Do they have any changes in shapes that might be affected with poor oxygenation? Do they have any lesions or any fungal infections? So in people that have darker skin, we can look for pallor on the mucous membranes or on the palms and soles of the feet. We can also look for any inflammation. And then, of course, jaundice is probably best of the conjunctiva. Diagnostics, so we can do cultures for any fungal or bacterial or viral things. We can do lots of different biopsies. We can do excisional where we cut around it. We can do incisional, which is a wedge shape through it. We can do a shave across the top of it. We can do a punch biopsy for right in the middle of it. We can also examine the skin underneath a Woods lamp, which is a black lamp. And basically, this is really nice, especially for fungal things. This is a quick rehash of assessment of the skin. If you have further questions, please contact your professor.